I think what made PR possible with pediatric ophthalm was that when I remember when in 2001 we were doing our post graduation, and we were told to read books for Strabismus, and one of the most important books was von Nuden, and I think it was the second chapter of von Nuden. I remember we were reading about the binocular vision abnormalities and about physiology of vision. It was a life-changing experience for me, because this was for the first time I was able to understand what exactly means to see, also the physiology of vision, how we see double, and the whole concept of egocentric localization, which means that you see things as yourself as the center of the universe. I think these all things made me really intrigued about the branch, and I personally felt that a connection that this particular branch is the branch which I want to do. There was a sense of logic in it. There were things which I could read in that book which were very much applicable. The moment you read the book, you come to your clinics, you can actually see that it works. You read cover test, you can do cover test, and you don't need high-tech gadgetry. So I think that particular book, I would thank von Nuden's book, and I think that particular book was a life-changing experience for me. I personally have been told by a lot of people that one of the most important characteristics of my work profile is commitment towards my branch and honesty towards the patients. I think these two things define me as a pediatric ophthalmologist and strabismologist, because I think what happens is when you are dealing with children, you are not seeing in short term, you are actually thinking of a real long term thing. So commitment is very important, at least from my side. I think commitment has helped me a lot, because no matter what happens, I absolutely never lost hope, or I absolutely never had an idea that what if this thing does not work. There was no second thought about my commitment towards pediatric ophthalm, and I think one of the major reasons why I could get the trust of patient was because of my total honesty towards patient. Because in children you have to tell the patients that at the end of the day you have to be you have to tell the patient that this could happen, this is the future of your child, and this is what is necessary for you or for the kid. I think one of the most important characteristics of strabismus and pediatric ophthalm is the word logic. The simplicity of the branch and the simple logic behind all the things. You don't really need a very high-tech explanation for why things are like this. You just need a simple logic on eye movements. You need a simple logic. The sheer brilliance of the branch lies in the logic of it. Everything is very logical. You can see it and you can prove it that this happens because of this. And obviously the high which you get is that every case is different. It's not, so with due respect to other branches, every case in pediatric ophthalmology is unique. Every strabismus is different. For me, doing something new, changing the things as they are, makes a real difference. I personally believe that pediatric ophthalmology and strabismus in a way has changed my life, because it has completed me as a person. The challenge of dealing with children, the whole challenge of the child not allowing you to do it and yet you can do it, makes the branch very interesting. I think the simple challenge of being able to examine verbal and pre-verbal children when they are not able to tell you, when parents are just telling you few symptoms and you are able to find out what exactly patient is having. When a child comes to you with a head tilt and child is 1 year and you can tell that child has supraoblique palsy, it makes your day. I did my fellowship from Aravind Hospital, Madurai. You have a lot of patients, everything is good. So when you come back from that dreamland, I think challenges are plenty, especially if you are, especially you are the first pediatric ophthalmologist of the state. There is bound to be, first of all, there is lack of acceptance. First of all, what happens is that nobody wants to accept. So that is a denial mode. Nobody wants to actually believe that there is a pediatric ophthalmology is a branch. So I think I would like to quote from Dr. Marshall Park's foreword in Kenneth Wright, where he rightly says that years back, even the branch of pediatrics was not taken seriously, and physicians used to feel that child is just a small adult. And I think that is wonderfully written by Dr. Marshall Park, he being the father of pediatric ophthalmology. I believe that sums up everything, all the struggles that a pediatric ophthalmologist has to go. I would just narrate a small incident. When I came back, from my fellowship, and I was supposed to meet people, look around the jobs and who can absorb me as a pediatric ophthalmologist, and I met a senior ophthalmologist, and he told me, this was sort of an interview which was going on, and he told me that, अच्छा आप pediatric ophthalmology में क्या क्या कर लेते हैं, sort of the way that what all you can do, and it is more like an interview. You are going for a matrimony and somebody is asking you, अच्छा आप खाना वाना भी बना लेते हैं. So that kind of interview goes on, and they are not really ready to believe. The whole point is that you have to stick to the goal, do your job, patients will come, but you have to be patient. You have to be patient for the patients to come to you. So you cannot do it in a short time. You are there in here for a long haul. I think what I did was I kept on doing good work, and I got recognized in the end. So I think perseverance and patience is the key when it comes to facing the challenges of pediatric ophthalmology. My advice to the young postgraduates who clearly want to do pediatric ophthalmology Strabismus is that you just have to ask yourself in your heart what branch you want to pursue. I do have fellows, and in my interview I don't ask any other question except two things. One, why do you want to do pediatric ophthalmology? And second, once you learn pediatric ophthalmology Strabismus from me, are you going to practice this branch or not? So I think I would like to quote Steve Jobs, his famous graduation speech, where he concluded by saying, "Stay hungry, stay foolish." I think this sums up the whole essence of what exactly we are doing in pediatric ophthalmology. Every day we learn new things, and every day we do things which are new, and then we try to find out what is going on. So remaining foolish is very important. Remaining hungry for betterment of patients is very important. So my point is that you should not just think of whether you are good with kids or not. If you have commitment towards pediatric ophthalmology Strabismus, you are bound to be good with children. That is not a problem. The point is you have to think what you want to do. If you think that you want to do one of the best branches, you take pediatric ophthalmology. If you think in general terms, any surgery or any difference that you make in a child's life does give you more satisfaction. It is bound to give you much more satisfaction compared to when you do it for adults.